Hello, Kinesiology 1018. Today we're going to go through chapter 14 on STIs. We're going to talk through our major STIs, including HIV, chlamydia, gonorrhea, HPV, herpes, and syphilis. Okay. When we talk about STIs, these major STIs, or sexually transmitted infections, they can have some serious complications and can pose serious risks for both those with the STI and in some cases towards fetus or towards the fetus or a newborn baby if the mother has an STI. So the highest rates of STIs in any industrialized nation is the United States. So we're talking, there are quite a few STIs in the United States and much more than most other developed countries. So it's something we need to pay attention to. Both men and women can contract STIs. It's not just strictly towards one sex or the other. But sometimes they are a little bit more problematic for women compared to men or females compared to males due to some of biological and social reasons. So let's go through some of these major STIs. HIV, or human immunodeficiency virus, which leads to acquired immunodeficiency syndrome or AIDS. There is no current treatment, there is no cure. There are some working treatments that are improving symptoms and reducing those negative consequences because this virus does affect the immune system, suppresses the immune system. So the risk of secondary complications from other infections just goes up and increases mortality risk. And we've been talking a lot about secondary infections when it comes to COVID-19, what we're going through right now, and what we're dealing with, especially with those with a compromised immune system. This infection can lead to death or other negative consequences because they don't have the capabilities to fight off that infection. Okay, so these secondary infections can be fatal. It's not AIDS or it's not HIV that causes the fatality or causes the mortality. It's those secondary infections or opportunistic infections that are really the new risk for this group of people. And most individuals are asymptomatic after contracting HIV. It can last for months, up to 20 years without any symptoms, which is extremely scary because you don't know, you won't know if you've contracted this virus. When it comes to transmission, how it's transmitted, blood, semen, vaginal fluid, and breast milk are the major avenues of HIV transmission. So blood-to-blood contact, sexual fluid contact, and breast milk. So if we're talking about different types of sexual contact or infected blood, if you're being exposed to new sexual partners, exposed to other individuals' blood, or if a child is exposed to breast milk from an HIV-infected mother, there can be the risk of transmission. Some of the kind of common ways that HIV is transmitted through blood contact is through shared needles and blades, so things like acupuncture, tattooing, piercing, especially from non-sterilized needles or repeated use. So if you're not changing out needles, it can be an issue, especially if you're sharing them with multiple partners. When it comes to mother and child, this is more of a threat in more developing countries. But it is something we need to pay attention to, something we need to think about moving forward. The symptoms of HIV are often kind of the symptoms of a secondary infection. So things like fatigue, rash, sweat, sore throat, things where you feel like you're sick, but you're also developing secondary symptoms, maybe other infections because you have a weakened immune system. Diagnosis of this virus comes from diagnostic tests, specifically blood tests for the antibodies for HIV. Some of those positive tests, if you do follow up, there will be a follow-up period, and then based on the severity and the length of exposure, you may have different treatment plans based on your stage of progression of the disease. Because there is no cure, there are only antiviral drugs that can help slow or inhibit the progression of the virus. When it comes to prevention, it's all about our behavior and what we do. If you're putting yourself at high risk, So not using protection, especially if you're having multiple partners, not using barriers, and also sharing of blood-to-blood contact materials. So sharing tattoo needles, sharing injection needles can put you at a much higher risk. Now we're going to move on to our next STI, chlamydia. Chlamydia is the most prevalent bacterial STI in the United States. Okay, so both men and women are susceptible, but the serious complications can come more in women or in females. Things like pelvic inflammatory disease, possibly infertility in both sexes. So it's something to think about. It's not something that we should shy away from. We should understand that there are some negative consequences for these bacterial STIs. Some of the symptoms, for men, it's often painful urination. Women, it's often increased discharge and pain during urination or bleeding outside of normal bleeding. So if you are having any pain or burning during urination, you should see your doctor. That is not something that is normal. And then having annual screenings, if you are sexually active, especially with multiple partners, can help you in early detection, because early detection is the first step to curing or fighting off these diseases. Chlamydia is luckily pretty easy to diagnose and to cure, just based on a urinary test, and then there is a single dose antibiotic that can cure chlamydia. Okay, so it's pretty quick, pretty easy, but you do need to have that detection. Gonorrhea is another STI based on a bacterial infection. It's more common in younger individuals, and it can also cause pelvic inflammatory disease and other negative consequences from untreated gonorrhea. Some of the symptoms, a discharge, painful urination, that's another key one here with the STIs, is painful urination, and also some swelling and change in bleeding. But this is a bacterial infection, so it can also be developed in other parts of the body, like the throat and the rectum. So understand that you're, just by altering your sexual practices doesn't mean that you're protecting yourself or your partner from gonorrhea if one of you have it. So it's more detection, and then there are drug-related strains, but there is treatment for gonorrhea. You can survive and you can cure gonorrhea, but you need to know that you have it first, and you need to take your treatment and take your treatment seriously, because there are more drug-resistant strains. And if you are taking antibiotics and you don't complete the antibiotic sequence, sometimes there are lingering bacteria, and that's where we get those more drug-resistant strains. So if you are prescribed a dosage of maybe 5 to 10 days, take every pill, take them on time. Just because you feel better doesn't mean that the infection is gone. I talked a little bit earlier about pelvic inflammatory disease. This is a secondary complication from chlamydia and from gonorrhea, and it can lead to infertility. So this is something to pay attention to, that you can't just shoo away these infections. If you have one, you need to take care of it as soon as possible. Okay, with diagnosis and treatment, okay, it's very difficult to diagnose, but you may have to have some biopsies and maybe some ultrasound or laboratory tests to determine if you have pelvic inflammatory disease, and then antibiotics are often administered to suppress the infection and to cure the infection. Moving on to HPV, we're moving back to a viral STI. This causes genital warts, and with viruses do not go away. We only just develop antibodies to them. And HPV is the most common STI in the United States and the most common viral STI. So chlamydia is our #1 bacterial, HPV #1 viral, and #1 overall. And about 80% of sexually active people are infected at some point. So it's a very common STI, and it has some outward symptoms like warts on the genitals, but often there are no signs, no symptoms, which is what makes it more scary. There is one vaccine called Gardasil, and it does protect against HPV, but it has to be administered around 11 to 12 years of age, and it doesn't have as much use after that. It's kind of in that pubescent time, prepubescent time, that vaccination has to be administered. Some of the symptoms, often there are no symptoms until there are maybe some warts, but it's often about 1 month to 2 years of incubation period. So you can have HPV, not know, and still be spreading. You're still contagious, and spread it without knowing for up to 2 years in some cases. So be aware. This is where regular screenings, especially if you have new partners, it's best to screen regularly. When it comes with diagnosis and treatment, you go see your doctor. They may, based on visually diagnosing those warts or lesions, and then often go through other tests, such as the Pap test, because HPV can also lead to secondary concerns like cervical cancers. So it's something we need to pay attention to. Just because you don't see outward symptoms doesn't mean that you may not have the virus. Another viral STI is genital herpes. Genital herpes is about, it's a little less common than our other few, but about 1 in 6 adults. And there are 2 different types. There's HVS1 or HSV1, herpes simplex virus 1 and 2. Herpes simplex 1 is oral herpes, and herpes simplex 2 is, think of genital herpes. And they are transmitted through contact with these lesions, because it does cause outward symptoms like warts and lesions, or sores in either the mouth for HSV1 or at the genitals for HSV2. But most people will have no symptoms and then develop symptoms later. With many of these STIs, there is a period where you're asymptomatic before you express symptoms. And that's a dangerous time, because that's when you're really more likely to spread these infections. There's also no cure for herpes, so unfortunately there's no cure. There are a few treatments that can help with suppressing symptoms and suppressing the spread, but there is no cure, and this is something you need to think about long term. Moving on back to another bacterial STI, syphilis. Syphilis used to be a very deadly STI until we started to develop antibiotics that can fight against syphilis. But this bacterial STI can be transmitted in many different ways, but it's often through openings in the skin, which we often see around the genitals. So it's an easier area for syphilis to invade the body. Syphilis will cause ulcers, especially within the first 90 days. Secondary syphilis will cause more like flu-like symptoms and sores. And then tertiary syphilis, this is a more systematic spread of syphilis, and it can cause cardiovascular damage, brain damage, blindness, and even death. If it infects the nervous system, it can often cause major neurological problems. So things to think about: if we have syphilis or you are diagnosed with syphilis, you can take antibiotics and you can get rid of syphilis, but if you let it linger, it can cause some long-term permanent damage. So what can we do in the end? Really, first of all, is understanding the educational component. So understanding where those STIs, what they look like, what are the symptoms, how can you be screened, how can you protect yourself? So I have a few resources here on the screen that you can go to. Just like this class, this is a way to get some education, some knowledge that can help protect you in the future. Because early diagnosis, understanding that you are at risk, understanding how you have to go through the process of diagnosis, and having regular screenings. Even if you're asymptomatic, regular screenings can let you know sooner rather than later, especially if you're engaging in any risky or otherwise risky behaviors, both sexual or if you're coming into blood-to-blood contact, contact with open wounds, open sores. These are areas where you have a higher risk of contracting these viruses and these bacterial infections. So it's something to understand. We want to understand so that we can prevent. Okay, the only real way to prevent STIs is to abstain from all sexual behavior and all blood-to-blood contact. Then you have a very, very low risk. But planning ahead, planning safer sex practices, having conversations about the sexual practices and protection methods that you and your partner would like to engage in, to make sure that you're both staying at a low risk and getting regular screenings so that you are keeping yourself and keeping your partners safe. Because the real goal is to not spread any of these viruses or these bacterial, and understanding if we have them, not to spread them and to treat them as fast as possible. All right, thank you for watching and have a great day.